Good afternoon, ladies and gentlemen. My name is Caroline Goedmakers, and I'm a PhD student from the Leiden University Medical Center. First of all, I'd like to grant a special thank you to the Symposium Committee for offering us the opportunity to present our work here today. And I'd like to extend our thank you to all of our collaborators, especially in CNOC, Dr. Zaidi, Dr. Arno, Dr. Smith, Dr. Graf, Dr. Buaro, Dr. Rana, and of course Dr. Assad Lak. Together we worked on this project to develop a convolutional neural network to predict adjacent segment disease in patients undergoing a single-level anterior cervical discectomy solely based on their preoperative cervical MRI. Adjacent segment disease is defined as the onset of new clinical and radiological symptoms after initial ACDF surgery at the adjacent levels from the index. It is estimated to arise in about 15% of patients, and currently we don't have an accurate prediction method, and therefore we trust the clinical expert's opinion, and we use this clinical expert opinion as a comparison to the performance of our own model in this study. We collected data from 2 academic medical centers in Boston, and we only included patients that were 18 years of age, underwent a single-level ACDF or ACDA, had no prior spine surgery, and patients that had a T2 sagittal MRI available in our clinical data registry. We also excluded patients that underwent surgery for malignancy. We were then able to include 350 patients, and we split our data set into 94 test images, 48 validation images, and 208 train images. We then developed a 2.5D convolutional neural network with 48 convolutional layers, 1 max pool layer, and 1 average pool layer. And we selected the 3 optimal sagittal T2 MRI slices and fed those into the model as a 512-512-3 input. We used various data augmentation techniques such as cropping, flipping, and scaling. And then we were able to achieve these results. We eventually decided to train 3 different models. We trained a VGGNet 19, a ResNet 18, and a ResNet 50. And our ResNet 50 was the one that achieved highest accuracy, as you can see here in blue, with an accuracy of 94%. And this is the corresponding confusion matrix. The sensitivity was 75% and a specificity of 97%. And this is especially striking when comparing our results to those of the clinical expert. The confusion matrix is shown here, and our clinical expert could only achieve an accuracy of 63%, a sensitivity of 44%, and a specificity of 67%. Of course, in order to use the results from our study, we first need to validate, and we are currently working within the Kaiser Permanente Hospital group to see whether we can validate our results within their cohorts, and also with the Rotterdam study, a big epidemiological study in Rotterdam in the Netherlands. And also we have to reevaluate our results over time, as ASD tends to increase in incidence as we increase follow-up. For future research, we think there's a lot of opportunity here. We could extend these analyses to multi-level disease. We could increase our own numbers and potentially also do this for the lumbar spine. And of course, the ultimate goal here is to incorporate models like these into our clinical workflow in order to provide our patients with more personalized treatment strategies. Thank you.